Well, I think knowledge exchange is a fantastic new form of scholarship and engagement which has been promoted by the Humanities Division here in Oxford. And I think it's a really good part of our work because it's good for researchers in that they are seeking to hone their research by engaging with external partners to further their understanding of their research area. And it's good for external partners in that it seeks the public good, the common good of those with whom we're working. In terms of my own work as a knowledge exchange fellow, it's helped me as a Christian ethicist to engage, listen to, attend to the kind of real problems, questions of people working in healthcare. So I've learnt about the challenges, questions which they face with respect to compassion, and that's fed back into my own research. Well, I think my research has become more focused on, it's clarified the questions which I'm trying to answer in my research with respect to compassion in healthcare. So questions about the way that time and narrative, both the lack of time but also the experience of the narratives of patients, the narratives of healthcare workers, how that shapes conversation about compassion. But also it's given me opportunities for quite concrete investigations into the way that various structural or institutional factors shape the practice of compassion, the way a healthcare department is organised, the kind of policies and guidelines they follow. But then thinking about the difference between public healthcare and privatised forms of healthcare. How does compassion figure differently? How is it shaped by different kinds of motivation within public and private care? And then looking further into the commercial sector, how does the new medical innovations in personalised medicine, which in a sense promises a highly individualised form of compassionate care, how does compassion look different, feel different? How should it be shaped by engagement with these new complex medical innovations? So it's both helped me to answer questions I already had, shown me new questions, and led me into partnerships, opportunities which I wouldn't otherwise have had. Well, the great thing about the Knowledge Exchange Fellowship is that the relationship which the fellowship initiated didn't stop at the end of the fellowship. So I'm continuing to work with the Royal Society of Medicine Open Section, now a council member with the Royal Society of Medicine Open Section, seeking to further their work as a learned society. I also got the opportunity through the Compassion Healthcare programme of being invited to join the Royal College of Physicians Committee for Ethical Issues in Medicine. So again, engaging in knowledge exchange relationships there. The most significant thing, perhaps, which has happened is, with a number of colleagues, starting a group called the Healthcare Values Partnership here in the University of Oxford, which draws on law, medical sciences, general practice, and working with an external body, the Oxford Clinical Commissioning Group, as well as with Oxford University hospitals in the gerontology department. Finding new ways of thinking about compassion, communicating compassion, and trying to make that clearer. So that's been the ongoing work, and that's carried on with my RSM colleague, Andrew Papanikitas, who's joined me in the Healthcare Values Partnership, seeking to do high quality research into core issues in healthcare and to make these practical, useful to colleagues working in healthcare, both in Oxford and elsewhere.